Hi, Dr. Ramar. How are you?
I'm good. How are you?
Good, good, good. Thank you. Welcome to In Good Health.
Thank you for having me.
Today we're going to be talking about hysterectomies.
One of my favorite topics.
Okay, tell us a little bit about your background.
I am an OB/GYN practicing out of McLaren Macomb. My office is right next to Partridge Creek at Women's Health North Grove. Graduated from Michigan State University for undergrad and Kansas City University for med school, and trained right out of McLaren Macomb for residency.
Okay, that's awesome. And so tell us a little bit about gynecology and how it relates to hysterectomies.
So gynecology, women have their gynecologist that they see for their annual exam and their pap smear every year. And that's going to be when you're going to bring up the topic of what are my symptoms, do I need a hysterectomy, what is a hysterectomy, how would that benefit a patient in day-to-day life. Okay.
And what would, cause a person to talk about a hysterectomy? Like, is it a routine practice or a routine procedure that one would have? Or
Definitely not a routine procedure, yet it's one of the most commonly performed procedures in America. Okay. It's something that it's very patient specific. It's not a certain age or a certain condition. It's when the symptoms are so severe that it's interrupting your daily life and your quality of life is impacted.
Okay, tell us about the symptoms.
Symptoms can range from anything. It could be abnormal bleeding, heavy periods, pelvic pain, painful intercourse, endometriosis, anemia. Sometimes malignancy or cancer is a reason that we're doing a hysterectomy.
Okay. And what are some things that women can do to foster good health and not necessarily need a hysterectomy?
Some things are out of their control. There's some things that are just structurally with the uterus in terms of fibroids that they can't control, but overall health will be a huge benefit. Staying active, watching your weight, watching what you're eating, all of that can lead to better health overall.
Okay. So a person comes into the office, they're complaining about one of the things you listed, you determine that there could be a problem, and now a hysterectomy may be an option. What do you do next?
The next step would be get a pelvic ultrasound and see what is going on with the uterus. Is there a reason that they're having such horrible periods or pelvic pain? Is there a large ovarian cyst, or is there a large fibroid in the uterus? So we'd start the workup there. You never want to jump right to hysterectomy because there's a lot of medical or less invasive procedures we could do first before going right into the OR.
And, are there concerns? Do these surgeries turn out really good in the end usually, or are there risk factors? Or?
Definitely risk factors. It's major surgery, even though you hear all the time, my friend had a hysterectomy, it went great, she was back to work in a week. A lot of those aren't realistic. It's major surgery, definitely not without risks. There's no such thing as simple routine surgery. But recovery, depending on the type of hysterectomy you have, could be anywhere from 4 weeks to 8 to 10.
Okay, so what options do women have when faced with hysterectomy as one option? What other options might they look at?
It should be a conversation between them and their doctor in regards to, is hormonal contraception or a birth control pill a good option? That can help really control bleeding. Is an IUD a good option for the patient? Or there's something called an endometrial ablation, which is still surgery, but it's a less invasive procedure, recovery is much less, and you can hopefully stop the periods and decrease pelvic pain before going to hysterectomy.
Okay, so it is very specialized according to the patient.
Correct.
So you put together a course plan that would, be geared toward what their issues are.
Yes. And one of the biggest myths about hysterectomy, everyone's always concerned that they're going to be menopausal immediately afterwards.
Okay.
Just because you have a hysterectomy does not mean you have to go through menopause. Their total abdominal or total hysterectomy does not mean your ovaries come out and you're menopausal. Total hysterectomy means your uterus and your cervix came out. If you leave the ovaries, you're not menopausal. Although you will no longer be having periods, you still have the hormones present, so you're not going to go through the symptoms of hot flashes, vaginal dryness, painful intercourse, or have a higher risk of osteoporosis or heart disease.
Okay, so you don't have to take everything when you do
Absolutely not.
hysterectomy. Okay. What kind of technologies are available now that can help minimize the need for a full-on hysterectomy?
So full-on, I believe when people say that, they mean total abdominal hysterectomy, meaning a C-section incision, you're in the hospital for 2 to 3 nights, recovery is much longer. The newer technology we have through laparoscopic surgery or robotic surgery, we're doing a hysterectomy instead of an incision this big, we're able to do it through multiple incisions this big.
Okay.
So recovery time is much less. You're in the hospital for 1 night, some patients go home the same day, and you're looking at 4 to 6 weeks of recovery before you can go back to your regular activities.
Okay, so given that there are different degrees of surgery that could be required depending on what your situation is, what what can a person expect? Will there be lots of pain regardless, or what kind of things can people expect after the surgery?
Definitely some discomfort and pain, but we can easily control that with pain medications. Your doctor will never send you home while your pain is uncontrolled.
Okay.
But it's still major surgery. We're removing a major organ. You're going to be sore. Minimally invasive or laparoscopic, robotic, or vaginal hysterectomy, your pain is much less. You don't have a big incision that we have to worry about. You're at less risk for infection. But recovery is still 4 to 6 weeks. Even if you're feeling great, which is my biggest complaint about minimally invasive surgery, patients feel great 2 weeks after surgery, but they're not healed internally. So you're feeling great, but you still need to give your body time to heal. Biggest concern after hysterectomy is the stitches that are in the vagina, because those stitches where the uterus and cervix used to be really take about 6 weeks to heal. So the most shocking thing that women expect or are surprised by afterwards is that they can't do much of anything for 6 weeks. It's no swimming pools, no hot tubs, no tub bathing, no intercourse, no heavy lifting until that vagina really has time to heal.
Okay, so you mentioned this robotic process where you punch a few holes to accomplish the job. Can you tell us a little more about it?
Absolutely. It's the Da Vinci robotic system. So it's a laparoscopic hysterectomy, and laparoscopic just means small incisions. So it's a total laparoscopic hysterectomy, but robotically assisted. The nice thing about the Da Vinci robotic system, newer technology, and you're not doing the operation by the patient's body, essentially. You're in a control center about 3 feet away from the patient where you're doing the surgery. It's like having your hands in her abdomen from across the room and through an incision this big. So regular laparoscopy is just straight stick. So you're moving the instruments, manipulating the pelvic organs as if you would with a pencil or a grasper. Da Vinci robotic surgery, it's like having your hands inside that abdomen where you can move your wrists and you can zoom in very close with the camera. So someone who's had a lot of previous cesarean sections or a lot of abdominal surgery, has really bad endometriosis, which can cause scarring, the robotic system is a great technology because we can keep that surgery minimally invasive, where years ago we would have had to open her up through the C-section incision.
Okay, yeah, that's pretty fascinating. Has that technology been around for a while?
It's been around for over 10 years, but it's becoming more and more mainstream now. Patients are getting more comfortable with it. Everyone's knowing about it.
Okay.
Everyone has a friend who had a robotic hysterectomy and they want theirs done that way. But you have to make sure you have the right patient for it.
Okay. And is McLaren Macomb one of the few hospitals that offer that, or?
Definitely, we have the robotic system, definitely offer robotic hysterectomy. It's just dependent on your doctor and if they're experienced with it and their training level.
So what are the benefits of doing the robotic surgery versus traditional surgery?
It's patient recovery time, patient decreased pain. Traditional surgery, you're in the hospital for 2 to 3 nights. With robotic surgery or laparoscopic, you can go home the same day, or you stay for 1 night. And your pain by 2 weeks, the patients I see in the office at 2 weeks postoperatively are feeling pretty darn good. Whereas an open incision, you're at a bigger risk for infection, longer hospital stay, higher hospital costs with that longer stay, and recovery time. Overall patient satisfaction is much better when you're not in pain for weeks on end after surgery.
That's great. I know you mentioned that there are various kinds of surgery that can happen to accomplish a hysterectomy. So are you saying that a vaginal surgery is one of those ways?
Correct. You can do a hysterectomy without ever making an incision in the abdomen. That is a hysterectomy for someone who has not had any C-sections, or someone whose uterus is not enlarged, or hasn't had a lot of previous abdominal surgeries. It's all very patient dependent based on your surgical history, your medical history, any of the other medical comorbidities that may be complicating your surgery.
Okay. All right, so people don't necessarily have to worry about that big bad scar.
Not at all, not today. Some women, absolutely, but definitely a discussion for your doctor to see what is the least invasive way your hysterectomy can be done.
Well, thank you, Dr. Ramar, for sharing so much great information about hysterectomies.
Yeah, thank you for having me.
To learn more, visit mclaren.org/Macomb Women's Care.